I'm Jon Youakim. I'm a pediatrician in Champaign. The stress of knowing that this is a marathon and that, even if I don't get exposed today, there's a whole, 10 to 24 months of this until, things get better. And just thinking of that is kind of stressful, and, trying to make sure that we are keeping families safe. So when we do get exposed, I have to take my temperature twice a day. If I have any, respiratory symptoms, I don't go into work. So, that being said, though, there are a lot of asymptomatic carriers. And so that's one of the concerns that we all have, is making sure that we're not exposing our, others, especially vulnerable people, to this virus, because we don't want to feel, the guilt of accidentally exposing somebody. So, at work, we're always wearing our surgical mask or a cloth mask, even at our desk. If we're coming to talk with one of our other colleagues, one of the nurses, so that we protect each other. So usually, they're crying for, well, we say crying for no reason, but they're not crying for no reason. It's a reason that the parents don't know. Or if they're obviously, more angry, have a shorter fuse, more irritable. Those are, concerning signs. Obviously, decreased appetite, trouble sleeping, those kind of things are signs that, you want to kind of make sure your child's doing okay. I always tell parents is, try to have time, throughout the day where on a, like, have the kids have a structure, try to make sure that they have some kind of physical activity every day, whether it's just going outside to walk the dog, going to, in the backyard to just run around, riding their bikes, whatever they need to do to get that energy out, because it'll also help them concentrate on their schoolwork. Recess has been proven to help children concentrate. So it's not just to have fun, it's to help relieve stress and the other things that come with that, the mental health benefits that come with physical activity. Yeah, I think, one of the things that came, like, as a silver lining that came out of all of this, is that we're able to bill more for telemedicine visits. So we're able to do like some well checks over the phone. We're able to do some like mental health visits over the phone. But even some of our nurses work in or live in areas where they don't have good internet access, or even good cell phone service. So it's very difficult to do those visits, even if they don't have to come, because we have people that drive like an hour and 15 minutes away to come visit us for their wellness, and so those people are suffering in their access to healthcare. And the other thing that concerns me, being in the area that I am, is that rural areas tend to have older populations.
Yeah.
And the problem is that these like infections tend to hit metropolitan, larger, densely packed areas first. People, get, initially they get worried about the infection, then it spreads, and then it starts to simmer down. And then eventually it starts to hit these smaller areas. That is going to be not if, but when.
Yeah.
And so if it didn't hit them in the first wave, they may feel, invincible the second time. And that may be when it gets them, or the third time, the third wave. This is a marathon. And so realizing that even though it's not in your small town yet, it doesn't take much for it to be in there. And then by the time it's there, a lot of people are already infected, including a lot of older people. And we just have to make sure that we aren't being cavalier with, how we're interacting with other people. Like,